Now we start scanning right iliac region or lower abdomen. For scanning of appendicitis or small bowel, we use linear probe. There is two methods to locate the appendicitis. First, we scan from umbilicus to the right iliac region to rule out appendicitis or scan the appendix. Or secondly, we place a probe at suprapubic area above the bladder and locate the distal ileum. Then we start scanning from distal ileum to the right iliac region to locate the cecum, and then we scan around the cecum to locate the appendix. It is easy method to scan the appendix which I used. So I always locate the distal ileum and then start scanning to right iliac region. Here we see the distal ileum and it connecting with the cecum here. The walls of distal ileums are normal and are not visualized. But here we see at ileocecal junction the wall of cecum are thickened and visualized as hypoechoic lining, which is muscle layer, and echogenic line, which is submucosal layer of the cecum. These are visualized when they are inflamed. Now we start scanning here around the cecum to locate the appendix. Now we fix the probe at that area and will tilt up and down to see around the cecum to locate the appendix. Here we see the gases in the distal ileum and also in the cecum. So it also creates hurdle to see the appendix around the cecum. Ultrasound waves are not passed through the gases and they obscure the surrounding area of the cecum. But as the surrounding tissue around the cecum are inflamed and echogenic, there is more possibility of inflammation of appendix. Now here we see the hypoechoic area with surrounding echogenic area. Now we will focus this point and slowly rotate the probe, that if it will be appendix then it become as a lumen. Now it become a lumen. When rotating the probe at its axis, patient is feeling pain on compressing at this point. Here we see an echogenic part in the appendix, which is maybe a food particle. Now we will measure the size of appendix. The appendix is poorly visualized because the soft tissue around the appendix are echogenic and inflamed. The anterior posterior diameter of appendix is 10.7 millimeter. The normal size of appendix is up to 6 millimeter. Now we will scan around the appendix to see any collection or free fluid. But we see no free fluid or collection, only inflammation of soft tissues present. Now how we will write report?